Hello and welcome to the COVID-19 pandemic update. I'm Kayode Okikulu. First, the highlights. Graduating medical students advised to be abreast of evolving technology and new methods of medicine practice to deal with COVID-19 and other emerging threats. The president of the National Association of Nigerian Students leads executives to the National Primary Healthcare Development Agency in Abuja to get vaccinated. And out of the country, Germany heightens COVID-19 measures as total number of deaths tops 100,000. Well, thank you for joining us today. We have quite a package for you on the program with all the vital COVID-19 updates you need to know from here in Nigeria and across the globe. But let's start off with an analysis of the latest COVID-19 trends.
141 additional persons in Nigeria have tested positive for COVID-19 in the last 24 hours. According to the Nigeria Center for Disease Control, the latest figures were reported from 11 states and the FCT and indicate a rise from figures reported 24 hours earlier. Lagos led with 46 new infections, followed closely by Benue with 44 cases. The FCT came in with 15 cases and Katsina registered 12, while Bauchi had 9. Kano and Delta had 4 and 3 cases each. Enugu, Kwara and River States had 2 cases, while Gombe and Plateau reported 1 case each. This report contains backlogs of confirmed cases from Lagos, Benue, Bauchi and Kano states, as well as the FCT. It also takes into account backlogs of community recoveries from the FCT. No new cases were reported from Sokoto State. The total caseload in Nigeria has risen to 213,818. 219 more people were discharged, bringing the total number of recoveries to over 207,000. There were no additional deaths from COVID-19 complications reported in the last 24 hours, keeping the total number of deaths to 2,974. There are more than 3,000 people on admission, while over 3.47 million samples have been tested. The latest update from the National Primary Healthcare Development Agency shows that over 6.1 million Nigerians have received a first shot of a COVID-19 vaccine, while over 3.4 million persons have been fully vaccinated. Globally, more than 7.4 billion vaccines have been administered. In Africa, there are more than 8.6 million confirmed cases and over 222,000 deaths recorded across countries on the continent. More than 259 million people all over the world have contracted COVID-19, while deaths are over 5.1 million.
A new set of frontline health workers have been commissioned to join the fight against COVID-19 and other diseases. They are fresh medical doctors graduated by the Afebabalala University, Abuad in Ekiti State, and they were reminded that a successful doctor must be part of evolving technologies in medicine and get acquainted with history. In a lecture delivered at the induction ceremony of the doctors, the resource person, a medical expert, advised them that a physician oath is a serious commitment which doctors must be cognizant of.
The reduced morbidity and mortality in this particular COVID compared to the Spanish virus is substantially due to the rapid development and improved methodology in the profession you are joining today. In Nigeria, we have had 175 compatriots infected, some of them multiple times, and 2,968 deaths. Their colleagues who are joining us today. Many of the dead are members of our profession, who, like us, were at the forefront of the battle to save our country and save our people, and indeed the world from the scourge of this terrible germ. In the city of Lagos alone, and between the 3 months of October 2020 to January 2021, we probably lost more doctors and other health workers than we did in the 2 years prior combined. I plead with you to take very seriously, with sobriety and commitment and responsibilities, the duties and the responsibilities of this oath as this will remain your guiding principle throughout your career. And just like the messenger RNA technology that has changed forever the way we make vaccines and maybe even treat diseases, and has allowed man to shorten the journey of 10 years in vaccine production to less than 1 year with COVID vaccine. This technology will yet have profound effect, not just on infections like COVID, but even on the treatment of cancer, as man has finally, overwhelmed by sheer efforts of hard work and determination, the twin effects of high inflammatory reactions and molecular instability that has held man back in putting to good medical use the mRNA technology until now.
And over to the nation's capital, Abuja, where the National Association of Nigerian Students, NANS, has endorsed the COVID-19 vaccines in the country and asks students in tertiary institutions to present themselves for inoculation against the virus. The president of NANS, Sunday Ashefon, led the executives of the association to the National Primary Healthcare Development Agency, where they were vaccinated to serve as example to other students. During the visit, the executive director of the MPHCDA, Dr. Faisal Shuaib, says 6 million Nigerians have so far received the COVID-19 vaccination and that no fatality has been recorded from the exercise.
The NANS leadership, after wide consultation with all ranks and files, including stakeholders and experts in the health sector, alongside our own survey and investigation on the vaccination of the citizen exercise embarked on by the National Primary Healthcare Development Agency. We wish to announce officially, the safety of this vaccine for all Nigerians and Nigerian students in particular.
We have emphasized the fact that in the last couple of months, over 6 million Nigerians have been vaccinated with COVID-19 vaccines safely. 6 million Nigerians cannot be wrong. We have heard in the past people saying, oh, if you take the vaccine, you will fall down and die. Nigerians, clearly we have seen that we have not seen 6 million Nigerians that have taken the vaccines fall down and die. And we're not going to see 6 million Nigerians that will die exactly after 2 years. We know these are fake news.
Well, it looks like the vaccination drive in the country has gotten some sort of booster shot at a time when the MPHCDA is also coordinating a mass vaccination campaign. Well, the program, which was launched on Friday, that's last week, and is in its 6th day. But how effective has it been? What's the target? And is this maybe the silver bullet to vaccine hesitancy in the country? We're joined on the program by the Director of Primary Health Care Systems at the NPHCDA, Dr. Nneka Onwu. For more on the mass vaccination campaign, she joins us virtually from Abuja. It's good to have you on the program, Dr. Nneka Onwu. And now we've seen states across the country embark on mass vaccination campaigns, some as early as November the 1st. Can you walk us through this version, the MPHCDA's version of the mass vaccination campaign, which is almost a week old now?
Well, thank you very much for having us, and really a pleasure for me to be here. Yes, this particular phase of our rollout plan, starting from the first one when we started in March, is, like you said, is received a booster shot. And what we are applying is the scales strategy. The scales strategy is looking at service delivery. And what does it mean? We're using vaccines. We're making sure that our vaccine gets to all eligible persons, no matter where they are. And what we are doing across the states and FCT, the 6 states and FCT, is to ensure that we expand the vaccine delivery, not only to the public facilities, but also to the private facilities, the pharmacies, the labs, our schools, our religious grounds, the malls, the parks, anywhere we have high traffic, to ensure that we reach everyone. The target is to reach at least 50% by January 31st. In addition, another thing about the scale strategy is the communication aspect, and one of it is what we are doing now, which is stepping up on our communication. Is also receiving a booster, and we are trying to sensitize as much as possible. Earlier, we were talking about the NANS, and that's part of the engagement. and we are engaging across, all stakeholders from the national down to the community levels. So all our platforms are quite involved in this. Also, as part of it will be, our regular press conference, not only by our executive director, Dr. Faisal, but also the Honorable Minister, as well as the Presidential Steering Committee. We want to enlighten people and let them know about the vaccines. Another thing about the scale strategy is accountability. We've heard about, people fraudulently getting the cards even when they're not vaccinated. So we want to hold each other accountable. And what we've done is to ensure that we work with other stakeholders, especially the security arm of government, to ensure that people who go out of their way instead of for their health, but to fraudulently get the cards are brought to book. So this is going on across the state. Even in the communities, we have whistleblowers. The logistics as well, as we have all these vaccines. We've been lucky to have a lot of the vaccines here. We have AstraZeneca. We do have also the Moderna. We have Pfizer and the J&J. So we also have to expand and strengthen our logistics system, make sure that supply chain is strong, and making sure that we are delivering as required. Of course, the EMID platform, which we have seen, is the electronic management of immunization data, which will expand going forward to PHC. Will also do that, and as well as supervision. It's one of the things we're doing. So we're expanding and working across the states, mass vaccination across all the sites.
So I wonder what the feedback has been like from people. Is that something that has been encouraging for this campaign, or what exactly has been the response from people?
Yeah, the feedback has been good because we actually expanding to other places where you wouldn't normally walk in and get free vaccines. And, seeing from the nuns yesterday, being in an office and declaring that they are urging everyone to take the vaccine. So we know that the students, are on. And people before didn't know where to get the vaccines. They don't know where the site. Now we are going to an area near you. If you are not there, please call us on our toll free. But we are expanding to reach everyone, anywhere we can find, because it's important that we have herd immunity. It's only when we have herd immunity that economy can, get revved up again. So this booster shot is also a booster for our economy, where people are now better protected and they're able to go around and do their business. And then the issue of economy opening up will be something of the past. So the feedback has been good. Yeah.
Right. So a couple of questions before we wind down on this conversation. For a lot of people, this is still new. I mean, yes, there's been a lot of communication and awareness, but not everybody knows about the process. So what's the process of getting vaccinated now? Do they have to register online? Can they just walk into any place? How long does it take to get the jabs? Because I think these are some sort of information that will help people, make that decision.
Yeah, you still have to register. But even if you don't register, you walk in and you get registered on the platform through our website, www.fhca.gov.ng. The links are there for you to get registered. But even if you walk into any private facility, the lab or the pharmacy or public facilities, you get vaccinated. The health workers are there to make sure that you get your vaccine. And it's just like that you get vaccinated. It doesn't take time. We've also started what we call moving up on the human resource, having volunteers support us through the mass vaccination. We recently launched the volunteer request, and you'll be surprised how many people wanted to support Nigeria to get this done. We had a lot of people volunteer. We have trained them, and we are finding them at this sites. A lot of our health workers, nurses, midwives, doctors have volunteered. Equally, the IT people and a lot of our teachers, and have signed up to support the country in terms of this mass vaccination. So it's not something that would take a long time. I think last time we checked, it doesn't take more than 5 minutes or 4 minutes to go through the process of getting registered and vaccinated. But the main thing is that you have to sit after the vaccination is given for a brief period, and that might extend it to 6 to 8 minutes, for you to get sorted. But that should be what we have seen, and it's not different from what happens all over the world in terms of vaccination, COVID and any vaccine. You may recall that National Primary Healthcare has been involved in vaccination rollout across the country for polio, measles, meningitis, and what have you. So it's something I've been doing with the states. Thank you.
Just before we run, how long is this for? Is it a long-term thing? Is it just for a few weeks, few months? On a final note.
for this particular strategy we are deploying, we're looking at having 50% of our people vaccinated by January 31st, 2022. And we have the vaccines, we have these vaccines enough to get us through that. But our plan is to get to 70%, the herd immunity that we require to make sure that people are protected from the COVID. So that is what we are looking at. But for now, for this particular one, we are going up to January 31st. But who knows, based on science and advisory, we might extend it further and also apply other things based on what we get on the feedback on how to make sure that we get to that herd immunity. It's only when we get our people protected that we can sleep safe.
Well, Dr. Nneka, it's been a pleasure speaking with you. She is the Director of Primary Healthcare Systems at the MPHCDA. We wish you the very best.
Thank you. It's been a pleasure talking to you.
We'll go on a break now, and when we return, we'll tell you about a new variant of COVID-19 that has been discovered across 3 countries, South Africa, Botswana, and Hong Kong. And we'll take a look at the situation in India as well. Just stay with us. You're welcome back. A new COVID-19 variant has been detected in South Africa, Botswana, and Hong Kong. And according to scientists, it's of the B11529 lineage with a high number of mutations. Well, speaking at an urgent briefing today, the South African Health Department gave details of the latest developments said to be concerning, as it can evade the body's immune response, making it more transmissible. The B11529 genome sequencing was done on samples collected between November the 12th to the 20th from Gauteng province. And experts say early signs from diagnostic laboratories show that the B11529 has rapidly increased in Gauteng and may already be present in most provinces in South Africa.
Unfortunately, we have detected a new variant, which it is a reason for concern in South Africa. And so what we have done is to act very quick, and that's going to become evidence as a truly collaborative network of scientists in South Africa, together with the government, to try to identify that as the case that just start to increase, to really know what really we are facing. So the main message to take is that you have to know the enemy in order to fight.
It was important for us for this to be made public as soon as possible, just to, amongst others, just to make us aware that while we had hoped for a very long, recess in terms of low infections, so that, a lot more opening up, a lot more activities, this has just descended on us. And as we have always said, we have no control. We had always hoped that any spike of infection leading to a 4th wave would be in the middle of December at the earliest, or late in December, or even in the coming year in January. But here is now a mutation, a variant of serious concern, which is now driving this spike in numbers.
So while we keep an eye on that developing story, it's perhaps no news that the WHO has tagged Europe as the epicenter of the pandemic, with over 60% of the world's cases and deaths over the past 1 week reported there. Well, this infamous epicenter tag has moved from continent to continent, first in China, then Italy. From there it moved to the United States, with the most recent being India. Well, India is no more hugging the headlines as it did about 6 months back. And the question is, how is India recovering and faring right now? I mean, talk about a country that was responsible for more than half of the world's daily cases and even set a record-breaking pace of about 400,000 cases a day. Well, Dr. Vishal Rao joins us on the program for an update. He's a member of Expert Committee COVID-19 Task Force State of Karnataka in Southwest India. He's also a Fellow of Royal Society of Medicine. He's a Director, Head, Neck, Surgical Oncology and Robotic Surgery at ACG Cancer Center in Bengaluru, Karnataka. It's good to have you on the program, Dr. Rao. And as I was saying earlier, just a few months ago, India was the epicenter of the pandemic. But the story is quite different today. How would you describe the situation in India now, and how did you transition, really?
Thank you. Thank you for inviting me for the show. I think if I have to sum this up in a line, I think we were having a race between the vaccination and the variant. And India today has been able to be above the world average in terms of at least completing 50% of the vaccination for the citizens eligible population. And that has led to this particular moment where we won the race of the vaccination over the variant. And I think this is true globally. Every country today is grappling with this issue where there is a race between the vaccination and the variant. And it is very, very important that every policymaker, every country's leadership team needs to take cognizance of this and put their best efforts to ensuring that the best way we have to prevent emerging new variants is going to be to raise up the vaccination.
It's quite interesting you talk about the vaccination race. I mean, you're a man of different parts. You invented an artificial voice box for throat cancer patients. And at that time, you priced it below $1, saying that speech is a right and not a privilege. Essentially, you're trying to ensure equity of sorts. Now, this takes me to the vaccine equity, the race for vaccination debate. I mean, India is also a producer of vaccines, so this, of course, resonates with you well. So I wonder what's your view of vaccine inequity as rich countries stockpile while poorer countries barely have enough jabs for even those who are at risk the most?
Yeah, this is a very, very interesting and a pertinent issue today, where people are talking about 3 for me, none for you. And I think this is a very, very, this is an important ethical debate that I think globally the world is looking at today. The WHO, I think in August, passed a moratorium on this, requesting countries to stop vaccinating booster doses until most of the countries of the world have completed at least 10% vaccination for their citizens. And if you look at the statistics of the world today, there are at least 10 countries that are below the world average. And if you look at Nigeria today, we are at less than 5%. This is a great concern, and it is important that every country of the world equitably, ethically takes part in this particular act justifiably to ensure that we make the world a safer place from this virus. And that would mean that we would need to look at equitable distribution of the vaccination, and what, like WHO has rightly pointed out, at least put a benchmark of 10% before we jump into booster doses. There can be select groups that countries can identify as high risk where they may require it, but as a general rule today, it's very, very important and pertinent to address the issue of vaccine inequalities across the world.
You know, incidentally, you made a statement at some point. You said the poor deserve the best. But I mean, clearly, if there's anything we've learned so far in life, that's not usually the case. You've also talked about the philosophy of copyleft as opposed to copyright. Do you think maybe in terms of solution that can help achieve vaccine equity, and maybe how?
Very, very true. In fact, you brought out a very important point. There cannot be a better time than the COVID pandemic to bring out the aspect of conscious capitalism, to bring out the aspect of copyleft, to look at wavering patents, to making stronger collaborations than competition at this point. We understand that a lot of the brands across the world are in competition to try and look at bigger sales of vaccines to stronger penetrations. It also is a responsible act at this juncture to ensure how we can have better access to vaccines for the poorest of the poor. Because I think somewhere down the line, many times this discussion comes up that what if COVID was a problem only for the poor? Would the world have looked at it the same way that we looked at it today, with such fervor, with such aggressiveness, with all the worlds coming together? And I think this is a larger question that we all need to ask ourselves, that how are we going to bring together our philosophies during this pandemic with a conscious capitalistic approach, where we try to solve the problem by making the world a better place. And that would require stronger collaborations, bridging of stringent commercial interests, and moving forward in a cohesive way to dissolve these borderlines and helping countries achieve the goal of wider vaccination to protect the world at this juncture.
Well, Dr. Vishal Rao, it's clearly an ongoing conversation, and I look forward to having this conversation with you, perhaps when things are less complicated, as it were. But it's been a pleasure speaking with you. Thank you so much for
Thank
sharing
you.
your thoughts with us on the program. Well, Germany has become the latest country to pass the sad threshold of 100,000 COVID-19 deaths. And to curb the rate of infection, new measures are being enforced, such as requiring passengers using public transport to either be vaccinated, to have recovered, or have a negative test result. Meanwhile, the European Commission says residents in the EU will need to have COVID-19 vaccine booster jabs if they want to travel to another country in the bloc next summer, free of tests or quarantines. The Commission is also proposing accepting all vaccines approved by the WHO for travel purposes, which would allow non-essential travel to the EU from outside the bloc for people vaccinated with Chinese shots and vaccines made in India. Well, here's more in the Global Update.
Germany has ramped up its COVID-19 measures after the total number of coronavirus-related deaths in the country soared over 100,000 on Wednesday. According to the latest data released by Germany's disease control agency, daily new cases also hit a new record of 75,961 over the past 24 hours. Passengers who wish to use public transport are now required to show proof that they are vaccinated, recovered from COVID-19, or have taken a negative test in the past 24 hours. Slovakia has entered a 2-week lockdown as the country with one of the EU's lowest vaccination rates reports a critical situation in hospitals and new infections topping global tables. Slovakia, a country of 5.5 million people, had ordered all but essential shops and services closed and banned people from traveling outside their districts unless going to work, school or a doctor. Gatherings of more than 6 people are also banned. France will make COVID-19 booster jabs available to all adults over the age of 18 from Saturday and reduce the gap from the last jab to 5 months, ruling out curfews and lockdowns to curb a 5th wave of infections. The country's health minister says from January 15th, booster shots will become a requirement for a valid health pass, which is required in France to enter restaurants, cafes, cinemas and museums, among other public venues. Finally, the EU's drug regulator has approved the use of Pfizer-BioNTech COVID-19 vaccine for children between the ages of 5 and 11, paving the way for them to be given a first shot as Europe battles a surge in infections. Pfizer-BioNTech's vaccine, which has been approved for European Union use in teenagers between 12 and 17 years since May, will be given in 2 doses. The approval comes as Europe is again the epicenter of the pandemic, again accounting for about half of cases and deaths.
Visit our website, channelstv.com, for more updates and a better understanding of the pandemic, plus other stories, all at your fingertips. Well, that's the COVID-19 update. Thank you for watching. I'm Kayode Okikulu. Goodbye.